Really glad to have Ann Brown in the studio with us this morning. She's a physician assistant with Baptist Health, here to talk about a condition that affects nearly 40% of adults at least once in their lifetime, and that is vertigo. Ann, thank you for doing this. I'm fascinated by this subject.
Glad to be here this morning.
Yeah, all right. I guess we need to start off with a definition of vertigo, because there's a couple different kinds, right?
Yes. There are two main types of vertigo, and really vertigo is the sensation of feeling dizzy or off balance, and it's not quite the same thing as saying you feel lightheaded. This is people who feel like they're on a merry-go-round, or they feel like the room is spinning around them. That is interesting to me as a provider, because I find that it's misunderstood. Vertigo tends to be more of a symptom rather than a diagnosis by itself. We have about 15 different medical conditions that can cause vertigo. So it's important for us to look at the pattern of the symptoms and what's causing the symptoms so we can find the best course of treatment.
Right, and to find that best course of treatment, you've really got to try to pinpoint exactly where this is coming from.
That's exactly right.
So there is, most vertigo, I'm speaking for you here, correct me if I'm wrong, is temporary? Most
is temporary.
Okay.
So two of the common types are what we call vestibular neuritis. I've seen a lot of that in clinic lately, and that's caused by viral infections in the inner ear. That is typically a very sudden onset. It's very intense. It's very scary for patients when it happens, but it's completely temporary. Usually lasts about 7 days or less, and then people go on their merry way.
And goes away on its own?
Goes away on its own.
Does it require any medication or treatment?
There are medications that can help it resolve faster, but even if you just let it be, most cases will resolve in about 7 days.
Gotcha. And then there's the more severe type, which is the permanent vertigo, right?
Yes. So when we look at someone who's experiencing chronic vertigo, the first thing I ask is, does it worsen with head movements? When someone walks into my clinic with vertigo, sometimes you can even tell by the way they're walking. People who experience peripheral vertigo, which is from an inner ear problem, will be very stiff. They look uncomfortable, and you can tell that they don't even want to turn their head to look at you.
Because they'll get disoriented?
They'll get disoriented, and it'll exacerbate those symptoms. There's also what's called central vertigo. That typically comes from the brain, and that's more consistent, where they feel the same whether they move or not.
So what are the treatment options if you've got the more chronic vertigo?
So the more chronic vertigo, the central vertigo, is almost always caused by migraines. And if you are experiencing this, if you have some degree of vertigo on a daily basis, talk to your primary care doctor, or you could see a neurologist or an otolaryngologist, that's an ear, nose, and throat doctor. They can evaluate you for that and see if it could be migraine related.
And I find this particularly fascinating, that vertigo is getting more and more common in your office. Why do you think that is?
So it tends to be a little bit seasonal. Vestibular neuritis, which I mentioned prior, tends to be caused by viruses. During cold and flu season, colds, COVID, the flu, we see an uptick in these cases during that time of year. So it always seems like February is the worst month, and by the end of March, it tends to trickle out a little bit.
Okay. Well, it's a fascinating subject. If someone is having more than just what seems like a passing episode of vertigo, when you're talking about, what, a week or so, right?
Yes.
Really need to reach out to your primary care provider and try to figure out what's really going wrong.
Absolutely.
Yeah. I know you'd recommend Baptist, of course. You've got the nice coat that says Baptist Health right on it. So
anyone that needs more information can visit baptist-health.com, or they can call 1-888-BAPTIST.
Right there on your screen, absolutely. So vertigo is something that can be treated no matter what kind you have. So, Ann, I enjoyed talking to you. Thank you so much.
Thank you so much for having me this morning.
Appreciate it. All right, we're coming back on Good Morning Arkansas right after this. Don't you go anywhere.